I guess I'm going to be the odd duck for the evening. My name is Therese Sander. I represent the 22nd District, which is Randolph County, Sheraton County, and a little bit of Macon County. So I'm totally out of my area. But you invited me, and I decided I would take advantage of the opportunity. Especially, I appreciated the format, since you were presenting to us rather than asking us questions, because the one thing that I've learned in the 6 years that I've been in the legislature is that there's an awful lot I don't know. And mental health is one of those issues that, unlike it seems like everyone else who's spoken already, it's not an issue that has touched my life personally. At least I'm not aware of it. I'm one of 10 siblings, and I come from a large extended family, and I can only think of one second cousin's child that I heard of who had mental illness. I don't know if I'm extraordinarily blessed or extraordinarily sheltered, but I have learned a lot tonight from what you have said. Some of the things that really struck me, I just wanted to share with you. Whoever handed these cards out, thank you, because I didn't bring a paper to write on. Co-locate primary care and mental health. It sounded like an idea worth exploring. Another thing that struck me, the psychiatrist's availability was only 4 hours a week. So totally inadequate for what I'm hearing are the problems. Dr. Robinson, who said mental health is a disease of the brain, and the brain is an organ, and it's a physical thing. And that's a perception that needs to be expanded to the public as a whole in order to engage them more intelligently on the issue. Our system is set up to handle crises and do interventions instead of prevention care for mental illness. I can see the sense of what you're saying, that we need to do prevention, and that it's if you really put the dollars and cents on paper, that yeah, paying for the medications might be less expensive, or at least no more expensive than caring for them in our Department of Corrections. And I have served for 6 years on the Department of Corrections Appropriations Committee. So I've kind of gotten acquainted with the substance abuse and mental illness issue in that respect there. The Medicaid cuts of 2005 affected a lot of mentally ill people. I don't have any personal information, facts, or anything to say yay or nay on that. That was just something that struck me when that statement was made. The Department of Mental Health has a budget for medications for people who can't afford their meds. But the auditors who used to work on the department to see that those funds were used in that way or not. I was not aware of that. I was not aware of that. There's a lot here to absorb. And as the comments came my way, I think they got increasingly more partisan. And I remember as a freshman legislator, people asked me, well, do you like it down there? I got there in 2002. And I have to honestly say, I couldn't say, yeah, I love it. Because I say I got there in 2002. It was 2003 when I took office. But 2003, 2004 was the most horrendous year for me, because I couldn't sort it all out. Everyone was giving me their economic equations. For every dollar you spend on our program, you save X number of dollars, and I heard some of that here tonight. And everyone expected, when they came to my office, and I tried to listen to everyone expected that their argument was going to absolutely convinced me that I should give them the money. But when push came to shove, there wasn't enough dollars to do all that. And we had hard choices to make. And I'm not a person who's experienced in economic development, or experienced in the law, experienced in law enforcement, experienced in the medical field, or any of those things. But I still had to make some of those tough decisions. And those are still going to be there, because the people of Missouri have to be convinced that something is worth paying for, or they won't vote for it, to pay for it. And so that's the challenge that I see. And I'm, you know, it's not so easy. It's not so easy. And it is important for you to continue to educate. So I thank you for helping to educate me tonight. I am going to take this as you know, it's not going to just drain out of one ear, in one ear and out the other. That's not the way I work. But I know I'm going to be facing some of those hard decisions again. Am I going to vote for mental health and not for corrections, or not for education, or Medicaid? I mean, there's just not enough general revenue there to cover all of those needs, unless the people of Missouri are convinced that they want to pay more to the state to do it, so that they have less to spend discretionary at home. And that's where our struggle is. So I just wanted to give you a perception of what it's like and what a new legislature is likely to face, because they are not easy decisions. But I do thank you for educating me some more this evening. I really do have a heart for the people who suffer in that way. I'd like to help them all, there's just not enough money there.